morning. I'm Ciro Rinaldi. I'm a consultant hematologist at United Lincolnshire Teaching Hospitals and also honorary professor of hematology at University of Lincoln. I started a molecular laboratory in hematology malignancy back in 2014. We started as a very small team, and then we grew over time, and now we have a number of PhD students, master students. The aim of the lab was to look into diseases and cancer of the blood that are currently incurable, particularly focusing on myeloid malignancy. An example of that is myelofibrosis, which is a aggressive myeloproliferative neoplasms, or myelodysplastic syndrome, a condition that can, over time, progress into acute leukemia. Those conditions are incurable, and for that reason, there is a requirement to understand more of what are the pathways implicated in the progression of those conditions. My lab focus on transcription factors, pathways that might be affected, that we can understand better and potentially target with new drugs, but also looking into the interaction between the cancer cell and the immune system and how we can interfere in this mechanism and potentially help to cure those conditions in the future.
Hi, my name is Annie Squires. I am doing my PhD here at the University of Lincoln. I am working within myelodysplastic syndrome, looking at how anti-CD47 blockers interact with the tumour microenvironment. And I'm now doing a direct co-culture, which is looking at phagocytosis within the tumour microenvironment. So within a flask, we are just looking at the cells together, seeing how the anti-CD47 blocker impacts phagocytosis and also with normal chemotherapy agents. The hopeful result of this research will show that within the tumour microenvironment, if we get a successful drug within a anti-CD47 blockade, we can then successfully cause phagocytosis of these cells and treat the cancer.
We genuinely believe that research is a core function of health and social care. Hi, I'm Professor Jazz Full. I work in Lincolnshire Partnership Foundation Trust, which is the mental health trust. I'd like to talk a little bit about mental health research. We have an incredibly bold vision because we recognise that there's a clear need to act on the best evidence-based practice for our patients and the people of Lincolnshire. We also recognise that we in Lincolnshire can be leaders within the field of rural and coastal mental health care for the UK. We genuinely believe that research is a core function of health and social care. At present, we're very excited because we're collaborating with the university and other stakeholders in terms of developing a mental health research group bid. Central to all of this is really our commitment to multi-professional development and support to improve a diverse range of research involvement, and really believe strongly as an organisation, as a system, that research and innovation can provide the right evidence to drive better treatments.
The essence is to ensure and to support research that's really grounded in practice. Hello, I'm Lorna Leaston and I'm a Senior Public Health Officer at Lincolnshire County Council and work to support a corporate programme of work to realise our ambition to become a leading council for research and innovation. As a local authority, we know that research activity, including findings and evidence, is integral in improving the support and the services that we provide to our communities. Our Lincolnshire Health Intelligence Hub provides a shared evidence-based resource for health and social care professionals in Lincolnshire and supports the building of that solid evidence base that's so vital in understanding and addressing local issues and priorities within Lincolnshire. Our aim is for all local authority employees to be research aware and to grow research interest and engagement. We have strong working relationships with the University of Lincoln. The benefits are mutual, bringing research closer to practice, generating new research knowledge that's relevant to service users and local communities, supporting knowledge exchange and enabling us to strengthen our local authority research culture. Areas of research interest and expertise include gambling-related harm, digital exclusion and prevention.
We're trying to understand how to improve pain management for children and young people who require an ambulance. My name's Greg Whitley. I'm a paramedic research fellow with the East Midlands Ambulance Service and an associate professor in paramedic science at the University of Lincoln. I'm currently on a NIHR postdoctoral fellowship, and as part of that fellowship, I'm delivering a study called the PANDA study. The PANDA study is looking to improve pain management for children and young people, and it consists of 4 different phases. So the first phase is a realist review, where we are synthesizing all of the relevant documents around pre-hospital pain management in children and trying to work out what works well for which children. The second phase of the study is recruiting children and young people, parents and carers and ambulance clinicians, hearing their stories and experiences and trying to understand what works well for which children. The third phase will be to do something called consensus workshops, where we bring all key stakeholders together around a table to decide which components of an intervention we want to put together to try and improve care. And it's probably going to involve some kind of education and training for paramedics and ambulance clinicians. So once we've done that consensus work and we've developed our new intervention, we'll move into the 4th and final stage of the PANDA study, which will test the feasibility of this intervention, and we'll roll this intervention out to a small number of ambulance clinicians to test whether it's feasible to do a larger trial in the future.
It's not just about, well, that works. It's about saying this is the evidence to say this works. Hey, I'm Eleanor Jeek. I'm the service manager of the mental health services in the community across the East and Coastal Services. I'm a mental health nurse, and clinically I feel strongly that we can see the benefit of physical health and physical activity on mental health. And so I was really excited and honoured to be able to be the PI of a piece of research we're doing at Skegness and in the future in Boston to look at physical activity with the Spaces programme and those with severe and enduring mental ill health. The aim of the programme is to offer an 18-week course of physical activity to encourage individuals to engage in that process, engage in exercise, and monitor the benefit of their health and their mental health from that. I feel really honoured and excited to be the PI because it helps me promote research. It helps me promote that lived experience of what research can do for our health and the services we offer, and making those services better. And it's not just about, well, that works. It's about saying this is the evidence to say this works. And the team can then see the importance of research in their day-to-day clinical activity.
We need real-world solutions developed in real-world settings, and I think primary care needs to be an integral part of our research. Hello, I'm Dr. Majid Akram. I'm Deputy Medical Director for Lincolnshire ICB in primary care. I've been involved in innovation. I've developed a platform called VMDT. Now, this is a digital tool that streamlines multidisciplinary collaboration. It improves chronic disease management and reduces the workload burden on our frontline teams. So as an innovator, I would like to share my learning with other professionals. So we need to build a culture where new ideas like this are valued and where innovators are supported, not isolated. Innovation has to be part of the day job and not an optional extra. So let's make Lincolnshire a place where research and innovation are embedded, encouraged and owned by every part of the system, especially in primary care and community care. There's a famous saying, it says, the best way to predict the future is to create it. And that's exactly what we should be aiming to do.
It can feel daunting to blend together practice and research careers. Hi, my name's Lucy Gavins and I'm a consultant in public health at Lincolnshire County Council. In my role as a consultant, I lead for public health on mental health and wellbeing. One of the areas that I have been most heavily involved in over the last few years is suicide prevention, and that's the space in which my current research interests lie. Before becoming a consultant, I worked in addictions research, and recently I've started to explore the relationship between alcohol and gambling and suicidality. And in March this year, I started a 12-month NIHR pre-application support fund award that will help me to apply for a postdoctoral fellowship in this area. My interests link closely to other research that you might have heard about in Lincolnshire, such as Glimmer. It can feel daunting to blend together practice and research careers, but my experience so far has taught me that those of us with more practice experience have a lot to bring to the research community, and there are loads of opportunities out there for us to get more research active.
Hello, my name is Dr. Matt Simmons. I'm a senior lecturer here at the University of Lincoln, and I work with Ciro Rinaldi here, and we're looking at lots of different research around how blood cancers work. We're particularly keen in working out about looking at new therapies for treating these conditions which are hard to treat, and finding particularly ways of returning on patients' immune systems to be able to attack and destroy the blood cancer cells. We use a combination of different techniques, everything from some genetics through to molecular techniques, and then we work with Ciro at the hospital to get into clinical samples to look at how these work and then translate our basic science into patient care and improvements for them.
Hi, my name is Nilüfer Emiryan. I am a second year PhD student at the University of Lincoln. Currently, we are working on myeloproliferative neoplasm in our lab. We have a new drug which name is beta inhibition. It's a kind of epigenetic modifier. We are using this drug to treat the leukemia patient. On the other hand, we are trying to give more power to the macrophages to make them enabled to kill the cancer cells. In our experiments, we are using flow cytometry, cell culture, and also indirect co-culture to see what is happening on our treatment. In the meantime, we are comparing the result from the beta inhibition to other drugs that are currently in the market to prove that our drug is working more effectively. So far we got some promising results and we are ready to move on to our next stage if the result were good enough, which would be the clinical trials on MPN patients.
Every level of activity has its place. Hi, my name is Kelly Moran and I'm a research nurse at LPFT. And I honestly believe that I get to do the exciting bit of research, and that's the research delivery side of things. So I ensure that people that take part in research are supported throughout their whole journey as a participant, and that's right from start to finish there. I ensure also that the study is conducted safely and effectively within our trust, and that's alongside the wonderful PIs we have here in LPFT. I get to work on observational, interventional, commercial trials, so no two studies are ever the same. And my passions really are about embedding research in everyday practice. So that's encouraging all of our clinicians of all disciplines to actively engage in research, you know, whether that's seeking referrals, whether that's promoting clinical research within their areas, or whether that's exploring their own research questions, because every level of activity has its place. And I feel really strongly that we all have a part to play.
This study has the ability to change outcomes for everyone with IBS. Hello, I'm John Andre. I want to tell you about the Lincolnshire Poacher study, which was sponsored by LCHS. This was a very important study of patients presenting for the first time to the primary care with IBS-like symptoms. This study suggested that 3/4 of all the patients with these type of symptoms, in fact, don't have IBS at all. We showed this in a randomized trial where we compared normal care by GPs for patients with IBS, following NICE guidance, versus a structured investigative program delivered by nurses who had been specially trained to do this. This study has the ability to change outcomes for everyone with IBS in the UK and across the world.
Here at EMAS, we are very, very proactive in research, and we're hoping to obviously become more proactive in the future with different trials that we're taking on board. My name is Dorothy Hutchinson, and I'm a pre-hospital research nurse. I'm working for East Midlands Ambulance Service. Pre-hospital research is very, very fascinating because we have technically 300 mini hospitals on the road. Current projects that I'm working on at the minute are Crash 4, which is about minor head injuries in older adults, because we know that a traumatic brain injury can have catastrophic effects, later causes of death and disability. So we're hoping that the current research with this trial, which involves giving a drug called tranexamic acid within 3 hours of head injury, will hopefully that it will reduce intracranial bleeding and the catastrophic effects that that has on our older generation. So the research itself is done by the paramedics, and they give the trial drug, the TXA, via intramuscular injection. It will either be the active ingredient or placebo, and that's how we will then evaluate the results at the end of the trial.
I'm Professor Kelvin Lee and lead the Clinical Cardiovascular Research Team. Allow me to introduce the Cardiovascular Research Program here in Lincolnshire. The program has been delivering over 45 studies in the last 10 years, with a few notable ones here shown across a wide portfolio of cardiovascular areas of interest by our investigators. Presently, we are running 9 studies, and with a further 4 studies opening later this year. We ran studies from both national research institutes, funding bodies, and research charities such as the British Heart Foundation, Diabetes UK, and the NIHR, as well as with industry partners in commercial studies with Boehringer Ingelheim, Novo Nordisk, Amgen, Esperion, Daiichi Sankyo, Terumo Biosensors, Pfizer, Janssen's and J&J, AstraZeneca, and Novartis, to name a few. We have received research grants and funding for our own studies from Diabetes UK, the European Foundation of the Study of Diabetes, the EFSD, as well as from our industry partners, such as with Boehringer Ingelheim and Amarin International. With over 28 publications in the last 5 years and a few notable publications in Nature, NEJM, Lancet, JACC, and Diabetic Medicine. And embedding our clinical research with clinical care, we developed innovative ways of healthcare delivery in Lincolnshire, which allows us to make a significant impact and to introduce the team, our research fellows, postdocs, investigators, and research nurses and administrators from the Cardiovascular Diabetes Metabolism and Inflammation Research Group at the University of Lincoln, the Cardiovascular Clinical Research Delivery Group at ULTHT, and clinician investigators, the researchers in Joseph Banks Laboratories at the University of Lincoln, and the Lincoln Institute of Rural and Coastal Health, and the Cath Lab team at the Lincolnshire Heart Centre. From all of us, many thanks.